Hello everyone, I am Dr. 𝐒𝐞𝐯𝐞𝐫𝐞. I am an ENT and head and neck surgeon in Sharda Care Healthcity Hospital. Today we are here to talk about hearing implants. Before we understand how hearing implants work, we have to understand a little bit about the mechanism of hearing. So our ear is divided into three parts: external ear, middle ear and inner ear. Sound falls on the eardrum like tiny vibrations, and these vibrations are carried into the middle ear and they get amplified there. These amplified vibrations are then carried to the inner ear. In inner ear, there is a very special organ known as a cochlea, which has very small tiny hair cells. These hair cells are getting stimulated with these vibrations, and once they are stimulated, they act as a transducer. So a defect or damage in any of these areas in this pathway can lead to reduced hearing or complete loss of hearing, which is also known as severe to profound hearing loss. Today we are here to talk about cochlear implants. Cochlear implants is the most widely used type of implant. It is usually used in severe to profound hearing loss. Cochlear implant has two parts. It has an external part, which is the audio processor, which picks up the sounds and converts it into digital impulses. And it has an inner part, which has a receiver and an electrode. The electrode is inserted into the cochlea and it transmits these digital impulses into the auditory nerve. And this is how we have bypassed entire inner ear, and this cochlear implant serves to directly stimulate the auditory nerve to transmit the sound to the brain. This is done via a surgical procedure which lasts from 1.5 to 2 hours. After a stay of about a day or two, the patient is discharged and is free to go home. Patient is sent on oral antibiotics and painkillers. Like any other surgery, take it a little slow for a week or two and keep the surgical site clean. You have to follow up with your doctor as prescribed by them, and after a period of 10 to 14 days, after which the surgical site has healed and the sutures have been removed, we will switch on the implant in the presence of an audiologist. This is when the sound is heard for the first time by the child. The most critical part of the cochlear implant surgery comes post-implant, where speech therapists along with audiologists and parents have to really work hard with the child, and maybe in another 6 months to 1 year, the child may start speaking again, and another 1 year he might catch up with his peers and lead a normal to near normal life.